Hi, Dr. Paul here. I got, again, another question I've gotten is, what's the difference between clinical depression and just being sad? So again, it's similar to the answer about anxiety, because the difference between anxiety and stress. Well, being sad is, all of us get sad sometimes. I mean, if you don't get sad sometimes, I'm really wondering why. That's not usual. I mean, if you don't, great for you. I mean, that's great. But most people get sad on occasion. I mean, I've gotten sad when I lose a pet. I mean, I'm a cat fanatic, and so when I lose a cat, it affects me very greatly. And so when people get sad with a lot of things, losing a friend, losing a grandmother, or grandfather, or a parent, or just basically just sad about life events that happen, losing a job. So there's reasons where people feel sad. Now the difference between that and clinical depression is depression really is more of a persistent and where you're not pulling out of it, where the sadness starts and it doesn't let up. And when I ask people, is this how you normally have felt in the past? And when I hear no, it's not. I go, when did it start? And they tell me when it started, and I ask them the details. Okay, let's start about how it progressed, and then you can basically, with getting a good history, with getting a good family history, just like with anxiety, you get a good family history, what genetics is going on. You take stock of their hormonal elements. You look at all the factors that lead to this to come to conclusions. But the clinical depression basically is when people tell me, this is not me. I'm not myself. And my job is to get them back to themselves again and resolve the depression. So it's very treatable. And I think people get, unfortunately, a lot of the negative comments are people who think that it doesn't sound right. It doesn't sound right that pills should make people feel better. People think that means addiction, and it's not. It's clinical medicine. It's just different than other areas because we don't have the testing that other fields of medicine have. But it's just as real, and people who suffer with it will tell you how real it is. So anyway, that's basically the main difference. And there's different types of depression. There's minor depression, there's major depression, there's different elements, but it's just all categories and that's not, I don't really care about categories and how many criteria, how many you can look at the DSM and look at the formal criteria for disorders. It doesn't really mean a lot, It comes down to, is the person suffering or not? And how do you know? You treat it. And if you treat it and it gets better, okay, well, there you go. That's the proof it's chemical. If you treat it and it doesn't work, okay, well, maybe it's not chemical. Maybe the situations are so bad that it's going to take some time, and we can't, like, if you lose somebody, you can't medicate grief. Everyone has to go through grief. It's really when the grief persists to the point where the person's not pulling out of the grief. Grief, there's no time frame to grief. Some people, it takes 1 to 2 years and sometimes longer, sometimes 3 to 6 months. It depends on the person. Everyone at some point learns that you got to move on in life. But it takes, when you're clinically depressed, it's going to take you a lot longer than if we treat it, get you through at least get the chemical part treated, and then maybe the psychological part, we can take care of that with counseling when needed, grief counseling, exercise. Hopefully I can help with people. When people are depressed, they're not usually motivated to exercise, so hopefully with the medications, I can help them with the motivation to actually get out and exercise, and then they're going to start feeling better and break the cycle. So anyway, that's kind of a summary of the difference between the two.